welcome to another edition of I'm Not Radioactive.
My name is Al Lar, and this is my partner, Willie Roe Rankin. How are you today, Roe?
I'm excellent.
And we are Paula's Protection Puppets. Hey, do you actually know Paula?
Duh, don't you?
Today's topic is radiographer protection. This has been an ongoing issue in the radiology field.
Hopefully today every radiographer will know how to better protect themselves. Let's hear about all the buzz from our friends at Misericordia. A radiographer should not receive an occupational dose of more than 5 rem per year. A reading above this level demonstrates carelessness by the radiographer to use proper protection. When on portables or during fluoro cases, the radiographer should always wear a lead apron and a thyroid shield, at least 0.5 millimeters thick of lead equivalent. Lead gloves and glasses can also be worn if available.
To reiterate, radiographers should wear minimally a thyroid shield and a lead apron. A radiation monitoring device should be worn outside of the lead apron at the level of the thyroid. Whenever possible, and especially in diagnostic radiology, the radiographer should stand behind a lead wall that extends 7 feet up from the floor with a window barrier that consists of 1.5 millimeters of lead equivalent.
The radiographer should set exposure factors appropriate to the part. Remember to keep the dose as low as possible while still maintaining image quality.
The radiographer should always use proper collimation to reduce the amount of scatter.
X-rays travel in straight lines and dissipate after 6 feet. Therefore, when taking a portable X-ray, the radiographer should stand at least 6 feet away at a 90-degree angle from the primary beam.
The radiographer can use the cord to judge the distance. In addition, the radiographer should always wear a lead apron and thyroid shield when taking portable X-rays. A radiographer should always keep ALARA in mind, since the use of appropriate exposure factors will reduce the amount of scatter, thus reducing the dose to the radiographer as well as the patient.
During fluoroscopy, avoid standing at the head or foot of the table. These are high exposure areas for the radiographer. When not assisting, stand as far back from the table as possible. The more distance created between the fluoro table and the radiographer, the more the dose is reduced. If assisting the radiologist requires that you be at the head of the table, drape an additional shield at the edge of the table to help absorb some of the radiation.
It is also recommended to wear lead glasses and gloves whenever available. Radiographers should never hold patients during an exam. Doing so would result in unnecessary radiation to the technologist.
In pediatric imaging, if the child needs to be held, a radiographer should first ask one of the child's parents to assist in holding the child for the exam. The child's mother should be asked if there is any possibility of pregnancy before continuing. If there is a chance of pregnancy, the radiographer is still not obligated to hold the child. Instead, they should ask a doctor or nurse nearby to volunteer to hold the child.
The pregnant radiographer is not obligated to declare their pregnancy. However, the unborn fetus is highly sensitive to radiation due to their rapidly dividing cells. Therefore, it is in the best interest for a pregnant radiographer to declare their pregnancy. Once pregnancy is declared, a baby badge should be worn at waist level and monitored frequently. Shielding is critical during this time. A maternity apron can be worn. That's all the time we have for today. Tune in next week when we cover patient protection. Special thanks to our partners at Misericordia for providing us with the most up-to-date information on radiographer protection.
On behalf of Val and I, thanks for watching. Hopefully today you learned just another tidbit on how not to be radioactive. See you next week.